Yeah, thank you, Anders. As the first keynote speaker, I would like to call Dr. Robert Landsiedel from BASF. Dr. Robert Landsiedel is affiliated to the BASF company and one of the heads of the German Society for Toxicology. He has a long-standing and broad experience in chemical safety research in vivo and in vitro. And this is, of course, the basis for being the person to propose testing strategies for nanomaterials hazard and kinetic assessment. So please, Robert, thank you for
Thank
coming.
you very much. I'm actually not going to present what I think or what I did, but I'm just the waiter for something which was worked in a working group in the nano-safety cluster meeting. This is the working group. And the task was to come up with a vision, probably for the year 2020, how should or would or will toxicity testing of nanomaterials look like in several years from now. And it's a working group, and you might see it from the names, it's both toxicity to the human health and the ecosystems. And I would like to start with just some general thoughts on what nanomaterials do in the body, and maybe to highlight the specificities and the problems. Usually nanomaterials don't appear as primary nanoparticles. Usually we have a powder, heavily agglomerated or aggregated, or we have it embedded into a matrix compounds, or we have it as a surface structure or surface coating. All these materials are generally not toxic because due to their sheer size they are not able to really interact with living organisms. They only become toxicologically relevant when they release nanoparticles, nanostructured materials, nanoscaled material, whatever, and if they release it into the air, it's an aerosol, and obviously in water it's a suspension. And only these can be taken up by the body, and upon uptake they might change their agglomeration state or their surface coating. In the body they will have a further distribution because they are internal barriers, and again some will penetrate those internal barriers, some will not, some will change when they penetrate the barriers, some will not. And then we have the presence of the nanomaterial at the target site, and we have primary effects. Primary effects, so far, not a lot of different effects have been described. Inflammation, the catalyzing of the formation of reactive species, oxygen species above all, but since nanomaterials are also used as catalysts in industrial settings, obviously they can catalyze a lot. They can release ions or molecules if they're partly soluble, not biopersistence, or one could think of direct mechanical, if you want, interaction with cellular structures. And that would later translate into the apical toxic effects, which is organ toxicity or maybe genotoxicity with the downstream consequences. The specificity compared to molecules, normal substances, is certainly that the form of the particles changes a lot. Yeah? We never know what we have starting from here in the end having an effect in the cell, and that's very different from a chemical which is dissolved, and usually it's always the same molecule. Obviously you have metabolism which may add to the variation, but the unmetabolized material is always the same when you talk about molecules, whereas with nanoparticles you do deal with a whole lot of different forms. And also, obviously, for nanoparticles, the distribution in the body, which compartments they can reach, is of utmost importance. Obviously, also for molecules, but here the situation is much more complicated. And that leads to the first problem. Testing one nanomaterial might not be applicable or not be relevant to another form of the material or another setting or another organism or another situation, because you start with different materials, the release may be different, the uptake form may be different, and what reaches the target cells may also be different. So you're dealing with a whole bunch of different scenarios, and the question is, well, how do you do testing for all of these? Will it be possible to test all of these? And obviously the answer is no. Yeah? How do you overcome those problems? And that's pretty much what the nanosafety vision tried to answer. We started with the status quo. The status quo is what's out there at the moment. And there's obviously on the toxicity part, the hazard identification and dose response assessment. And the assessment was that for the hazard identification, most of the studies which are published are non-standardized methods. Not using OECD protocols, in early years not even using standardized dispersion protocols. And that makes the comparison of the different results very difficult. Also, many studies don't report really no effect concentrations or no effect levels, especially for in vitro studies. It's yet another problem, but also in vivo studies often do not report a dose-response relationship which is usually usable. And then we often don't know what is the relevant form of the nanomaterial. Yeah? So it was tested in one form. If the dispersion protocol and characterization was well done, we know what form was tested, but we have little idea how it relates to those nanomaterials we are actually exposed to and their agglomeration state and their surface coating. And we don't know which combination or single physicochemical characteristic of a nanomaterial really drives the toxicity. So far, no one material characteristic has been identified of being universally responsible for the effects we see. Obviously, surface reactivity, surface area, size, shape, all that has been discussed. Probably they all contribute, but probably none of them as a single factor. For the exposure assessment, it is pretty much the same situation. Exposure assessments, maybe I don't have to go into details because it was covered by other sessions. This is just to illustrate it, and that's just pulling together the published data on nanomaterials for manufacture and use, physicochemical properties, toxicological information for different materials. And you see, obviously there's a lot. It's different information for different materials. And in a way, it's pretty stupid statistics because basically one very good study would be enough, so 700 is not necessarily better. But what gives you an impression, if you filter which of those fulfill the criteria for well characterized, giving dose-response relationship, and so on, the numbers are much lower. So about 10 to 12% of the studies really are useful for risk assessment at the moment. The point we want really to make is that at the moment, classical risk assessments go with hazard identification, dose-response assessment, and exposure assessment pretty much as very separate processes. And they usually only come together at the end when you compare these two with this, and then you do your risk assessment. So it's separate. It's pretty standardized, especially the hazard identification under REACH. It's really laundry lists according to tonnages. There are some feedback loops, but it's really a standardized procedure. Also, the test protocols are standardized. You use OECD protocols. The interpretation of data is standardized. How you perform it in the lab, it's all very standardized. So there's not a lot of variation, and it's very separate. And to this reason, it's also quite wasteful, because you do obtain a lot of data. And in the end, out of the hundreds data and studies you perform with a chemical or probably a nanomaterial as well, you use 3 or 4 to do the risk assessment. So 95% of all data you obtain are just not relevant for the risk assessment in the end. The vision for 2020 would be, first, obviously, you would integrate that. So you won't run it as separate processes and pull it together at the end. And that has nothing to do with nano in specific. it's just general, and that's what the integrated risk assessment idea is. So you would have interaction between and information flowing and triggers between these three. Then obviously you would have to have relevance criteria if you want to have triggers and crosstalk between these columns. And we also think, and that is not exclusively, but it's especially relevant to nanomaterials, you would have to have much, much more emphasis on ADME or kinetics or however what you want to call it in human toxicology or E-fate in ecotoxicology. BM is probably not relevant to nanomaterials. Probably it would be nothing or a C for coating. But anyway, the whole kinetics part, which is not the effect, but the fate of the material in the body or the ecosystem, is even for chemicals more important, but especially for nanomaterials. And that's the basic ideas about the testing strategies. And then for the testing methods, we probably need some add-ons. Obviously, we need for the standard tests adaptations in terms of test item preparation, but also we would use future and specific endpoints, and I'll talk about that later. There might be some endpoints which are not covered at the moment, which are specifically relevant to nanomaterials. There are probably also endpoints which are emerging not only for nanomaterials, but in general in toxicology. And then we need screening and early markers and confirmatory studies just to serve this integration from exposure and dose-response relationship assessment to the hazard identification program, because you need to have ideas and rules, criteria, but you also need to have studies to feed these criteria. And that's pretty much how we see the vision of future risk assessment. I have pulled together a few points which are related to this one, future and specific endpoints. I guess immunology was well covered. We don't have to talk about it anymore. Epigenetics is a topic which I just want to touch briefly, but it's certainly an emerging topic and will be in 2020 relevant for chemicals, but also for nanomaterials. And maybe just to point out that probably a lot of metals act through epigenetic mechanisms, and since many nanomaterials are metals or metal oxide, it might be also relevant for them. So this will be included in our testing programs in 2020. And then I wanted to just point out that we have some parts of toxicity which are probably particle related, maybe not just nanoparticles, which might have a different chance of being resolved than just through testing or even integrated or intelligent testing strategies, and that's carcinogenicity and cardiovascular effects. And there might be, as long as it's just particle toxicity, there might be a general concept behind it. And as you know, I mean, inflammation is one concept discussed, overload is one concept discussed, there are more. So maybe for these endpoints, and there might be more, it might be a good idea not to go into testing strategies, but to address it through research on general topics, general concepts. So, for example, asking the question, is unspecific particle present triggering inflammation which leads to lung tumors? And how is the inflammation or the deposition related to cardiovascular disease? And you might learn some general principles which also apply for nanomaterials as other particles, and that would save us a lot of testing. For ecotoxicity, there will be the combination of standardized endpoints, and that would be the link to conventional chemical substances, and additional endpoints for nanoparticles. There will be considerations on compliance testing, because if you have early markers and screening, you will need to have compliance testing. All three compartments will be considered initially, but as you refine your testing due to information flowing from the early studies and also the exposure information, you will be able to exclude some of the compartments, maybe in later tier testing. There will have to be a decision on the selection and number of species to be tested. And this also goes to the cross-talking and integration. There will be consideration of the actual environmental relevance, and that can only be answered eventually by monitoring. So we pulled together some existing thoughts on how future toxicity testing for nanomaterials will look like, and I'll just give 3 examples. One is of a review, and that was published 2009 on genotoxicity testing. And it ends with really 7 recommendations, which I quite like and I think are applicable and worth keeping in mind for also 2020, and that is you should know what nanomaterial you tested in what form, and that very much goes to characterization and dispersion protocols. You should recognize that not all nanomaterials are the same, and probably there is not or very limited nanospecific toxicity in general. There's just toxicity of nanomaterials, which may be different from the toxicity of the very same material as a dissolved molecule or a larger particle. But a unifying, applying to all nanomaterials toxicity might not be there or might not be as relevant as the very toxicity of the specific nanomaterial. As said before, we should consider and pay more attention to uptake and distribution of the nanomaterial. And we should look at the nanomaterial's specific properties. Again, a high surface area, a specific shape, a specific composition or size may be relevant. We should aim to use standardized methods if we ever want to be able to compare and make use out of different results from different studies. And I think there is a big need of in vivo studies as we develop in vitro studies or screening studies or anything, because there's actually quite a lack of reference data. So we can do in vitro studies and we will never know what the relevance is unless we have some in vivo data to compare it to. And ultimately, and that is also a prerequisite of modern toxicity, we should aim to understand the mechanism by which nanomaterials and different nanomaterials act. Another one was published last year by Silvergate, and that was just a scheme outlining, and that was very much, it was published in alt-text, so it was geared towards alternative methods. But it also said, well, we foresee that there will be a big role for absorption or kinetic studies. We will have effect testing, and we will have specific testing, and we will have targeted, maybe short-term testing to confirm it all. And you can see there's the element of in vivo studies, there's the element of early markers, there's the element of crosstalk, and there's also the stressing of the kinetic as an important factor. And the last was suggested at a cooperation which was in APERA, came from the Joint Research Center of the EU, a scheme which is pretty much a little bit more elaborate, but also said, well, in order to test, you don't have to test it all. You can look at cellular or nanospecific effects and uptake, and if you have both, you really need to test a lot. If you just have uptake, but really no effect on cells, you probably need, your main concern is accumulation. If you have uptake and accumulation, you might only have to look at those organs where the nanomaterials actually are present and accumulate. And if you have only cellular toxicity but no uptake, you probably only have to be concerned with local concerns. And that's really also pointing towards a targeted, or as we call it in our vision now, a concern-driven testing strategy. So the paper we prepared looks like this, and obviously the background, the state of the art, which I just covered, and then there's the vision, which will be the rest of this talk, in addition to the recommendations. And the main points are the dispersion. I won't talk about this because it's obvious and I think well covered in this conference. Strategies for biopersistence and kinetics for human and for the environment, and grouping. Grouping, as you shall see, very much plays into it and is probably maybe the most important part of all of these testing strategies. And I will end with some recommendations, which was ultimately what the EU wanted from this working group. So the Vision 2020 is a concern-driven testing strategy, and the concern-driven guidance for toxicity testing of nanomaterials. It will be based on the expected exposure, the exposure routes, the material properties, and the hazard and biokinetic data. And all these data will define what testing is really needed, because they will define the concern. And that's obviously also very much in line with the 3R principle of reduction, refining, and replacing animal experience. And also all these data will also be useful to be applied for grouping. And when we talk about grouping at the moment, we very much think of grouping by chemical structure, but there might be much better or more elaborated possibilities. The basis for that is that obviously concerns are driven by the dissolution in physiological relevant media, by biokinetics, by utilization of modelings. Grouping, likewise, will use all these data, but also similar or common biological effects, and that's grouping not based on material properties, but based on biological properties, or even the same DOS metrology. So all the testing strategies for toxicity and ecotoxicity alike will about look like this. First of all, you need to identify that you have a nanomaterial, which seems trivial, but whoever followed the discussion about the definition of nanomaterials knows it's not at all an easy task. Yeah? And there will be, even with definite definition, there will be discussion ongoing, is it a nanomaterial or is it not? Second will be, is it a nanomaterial of concern? And that will mainly be driven by, is it soluble? In what form is it dispersed? Is it dispersed at all? And you can easily see if you paint a garage with a paint which is nanostructured, the garage is a nanomaterial, but it's not of concern, yeah, because you can't swallow it, you can't inhale it. But the dispersion of the particles on the surface will be a concern. So dispersion is the use, the release, and the exposure will also be of a concern. Obviously, when you don't have a release, you probably don't have much of a concern. And then you will need to identify what concerns you have. And with chemicals so far, we basically, if you have the right tonnage, you have a concern for everything, and you test everything. And we think in future, especially since nanomaterials will come in large numbers and in very different forms, even increasing the numbers, you will have general concerns which are always there, but you will have also concerns related to the exposure route. So if you know it's just applied to the skin, you may not be so much concerned with inhalation uptake, just as an example. The properties of the bulk material will give you some indications of concerns. Also the modifications of the material, and obviously the actual nanomaterial and its characteristics compared to the bulk material. The concerns will be further defined, either extended or further refined by looking at the biology. So biopersistence, uptake, distribution, coating, elimination, early biological effect, and also apical biological effects. And these two will define your concern-driven testing program, and in fact will be part of the testing program. And ultimately, you will end up with targeted testing only for the points of concern. And that's a targeted concern-driven testing strategy, which will not save a lot of testing as such, but it will save a lot of standardized animal testing. For human health, and that was elaborated by TNO, which I'm very, by RAVM, which I'm very thankful for. We can't go through all of it, but just to point out the general principle, and that's just a suggestion how it could look like. You have a tier 1, and the tier 1 is basically the identification of the concerns as outlined before. And then you have a tier 2 testing, which is probably addressing local tolerance, genotoxicity, uptake and distribution, and general toxicity, and that can be short-term testing. And based on all of these data, you would make a judgment. The judgment would be, well, what tests do I need to do? And the judgment will include the outcome and the knowledge you have already on exposure, on material properties, and on biological and biological fate information. And these are just some suggestions which could be done. The list will probably evolve until 2020. And once you use these test options, you can use the information for two things. either for grouping and waving or for the third tier testing, which will probably much look like the testing we know of chemicals at the moment, probably with some additions. For ecology, it will not be much different, and we tried, and that was also quite a brave undertaking, to have toxicology and ecotoxicology agree on a common concept. The concept is the same. Obviously, the testing strategies which evolve from it are a little bit different, but you can see here there's also a step one, and the step one is basically basic early testing, including compliance testing, and also addressing the mode of action with some interplay around here. But eventually, the step two, which would be the higher tier in the toxicity testing as well, would be only to test those endpoints and those species and those media which are of concern. The testing strategy would look like this, and I won't go through this into detail. The principle is basically the same, yeah? Just the three media. The qualifiers are addressed here, and you need criteria to decide when you go on with testing or when you don't. And you have a tier 2, which looks pretty much the same. The testing methods would be the full testing method in this example. Grouping would be a whole another story, and as it looks today, we have nanoparticles in different sizes, of different materials, of different surface coatings, of different shapes, and the very same. This all could be the very same material. Yeah? And if you multiply this by different materials and then different release scenarios and then different agglomeration states, you end up with millions easily. And it will not be possible to test it all in a full-blown testing. You might not need to test it all in full-blown testing, and especially, and that was, I guess, many nanotoxicologists' dreams 5 years ago, we'll find a physical-chemical property which drives toxicity, and then it's easy. Same size will have the same effect, same surface reactivity will have the same effect, same shape will have the same effect, and that would be easy for grouping. And my labs as well, we spent millions on trying that. It didn't work because there is no one unique property which drives toxicity. It's probably a combination of 2, 3, 4, and probably also some factors we don't understand yet. And whenever in biology, when you have not one factor, but a combination of 3, 4 with complex interaction with the biological system, it's very difficult to make an easy model out of it. Therefore, the idea was, well, what if we don't take only material properties, but also biological effects? Why not take early biological effects, strength of inflammation, for example, or biological fate, like biopersistence. So if it dissolves rapidly, they probably have something in common. Probably chances are much better if you combine material properties, biological fate information, and biological activity, probably early biological effects. And if you combine all these, you might have a much better chance to have some grouping which actually works and is scientifically valid. Just to illustrate, there will be a lot of testing if you do it particle by particle, surface coating by surface coating, size by size, application form by application form. If you manage to do some grouping, and I try to do the grouping to make it not look like it's based on material properties only, you obviously will have to run a lot of less testing programs. And grouping may be applicable only for certain aspects of toxicity, but even that is quite a big step forward. And that was basically our vision for 2020. To sum it up, the recommendations, it's 3 slides. The one would be concerning the testing strategies. And the testing strategies in 2020 for nanomaterials will be concern-driven testing strategies, we hope. So again, exposure, material properties, biopersistence, biokinetics, primary and apical effects in toxicology will be summed together to define concerns which are then addressed in testing strategy. So we will use the concerns to choose the right toxicological study in the end. And obviously we will need criteria for this decision making, which will hopefully be developed by 2020. And to go a little more into detail for ecotoxicity, the criteria will be trigger values, and we'll need the extent of toxicity testing will have to be defined. The accumulation will have to be considered, and there will have to be compliance testing to confirm it. And 2020, as the whole field of toxicity is moving towards adverse outcome pathways, or Tox 21C, or mechanistic toxicity, however you want to call it, we need to define adverse outcome pathways for nanoparticles. We need to come from, this is where they end up in the body, this is the form they end up, this is what will be triggered as an early effect, and this is how the effect will perturbate into the apical effect. And that needs to be defined for nanoparticles, and probably there will be more than one adverse outcome pathway, I'm pretty sure of that. When you come to testing methods, and that is a big recommendation, I think it's not useful to do any testing if it doesn't serve one of these criteria. So I'm almost done, one more slide. If it doesn't help you to understand the mechanism, if it doesn't help you to define a testing strategy, if it doesn't help you to address a concern, you shouldn't do the testing. We need to update the existing methods, especially in terms of in situ characterization and test item preparation. We probably need some updating of some methods. For example, bronchoalveolar lavage in inhalation studies is an obvious addition which is useful for nanomaterials. Epigenetics was mentioned as an emerging topic in toxicology, which will certainly be also relevant for nanomaterials. For some materials, as I said, for some effects like lung cancer, maybe cardiovascular disease, there might be a chance to establish general concepts rather than having specific testing for each and every material. And for the ecotoxicity, we need to have concepts for environmental monitoring to verify the effects detected in laboratory tests. And lastly, for the grouping, maybe no need to repeat it because it's just 3 slides ago. We need to define and validate scientifically sound grouping criteria. And they will be based on not only material properties, but also on their persistence, on their uptake, distribution, coating, and elimination, but also on primary and apical effects. That was our vision for 2020 and how we think toxicity testing might look like in 2020, or actually we hope it will look like in 2020. Thank you very much for listening.
So, questions, comments?
You change metabolization by coating in the ADCE, ADME. So coating is all what you expect to happen in a nanoparticle or enters inside the body?
Yeah. Well, I don't expect it. I know. We all know it's...
And then aggregation, dissolution, changing of conformation of proteins, everything is coating?
Well...
So surface effects?
It's better than M. I mean, if you propose another letter of the alphabet, I'm happy with it. Just to make clear, it's not metabolism, it's something else. And coating, corona, aggregation stage, whatever.
Everything's about the surface, things happen on the surface. Okay. Thanks.
I will take the liberty as chairman to ask a question. When you say there's a need for updating of methods, first of all, I totally agree that it's a very good grouping idea and so on. And you say there's a need for updating of methods. As an ecotoxicologist, I'm a bit caught in between, so I don't know what to think. So now I would like to ask you. There seems to be a trend now that, of course, we go on our OECD methods and we try to adapt and see what can we do to make them fit to particles. But I'm become concerned lately that maybe we are not able to to adapt our way through. Because, as you also point out, we are not dealing with solute chemicals, we are dealing with particles that by nature are different. So do you think that it's that way we should go, adapting methods, or do we need to start on another clean piece of paper and say, for ecotoxicology, we have not been used to testing particles, so basically we don't know what we're doing?
Well, I'm not an ecotoxicologist, I'm a toxicologist. For toxicology, I would say it doesn't make sense to start from scratch.
No.
For ecotoxicology, there's at least somebody in the audience who has worked on the group. Maybe you can answer the question.
If you can answer it, it would be great. No. But when you say that for toxicology, I agree that we have standard methods, and of course we need to say for regulatory purposes we need to support the system that's here and so on. But for toxicology, that's because you feel that we have a background, you have a background in handling particles.
Yeah.
So you will be able to face the problems or have seen some of the problems. Okay.
Yep. I mean, again, there needs to be adaptations, but particles, I would say we run about 50, 60 annihilation studies per year, and I would say more than 60% are particle studies, aerosol studies. So a particle is not a new thing to us, and we do have a lot of experience.
Can I, as the ecotoxicologist, I think I'm supposed to address this question. I think we have to be careful with starting from scratch, basically. So I tend to agree with the speaker there and my co-worker in this field. I think we need to think also that the OECD protocols don't apply to many of the other standard chemicals anyway, or we think that, some modifications need to be done in ecotox area, like the standard sediments or standard media and so on. So there are a lot of issues out there that we are still and will continue to discuss in regards to this. Of course, they are more acute in relation to the nanoparticles. It's still, although we've been working for a few years on that, still early days, the concept starting afresh, it could delay the whole process quite a lot. So I think we need to be very careful there. But of course, I do agree with you with the concerns and to keep changing and tweaking and here and there. So we need somehow to move and not keep debating the same issues, I guess.
I'd like to make a comment about the in vitro testing strategy and moving away from mammalian testing while we've got the opportunity to do that with a fresh strategy, as it were. I think we can put more in vitro into this, and for example, some of the in vivo organ work could be done in vitro. For the cardiovascular system, we could do endothelial cell cultures to look at nitric oxide induction. That will tell you if you've got a vasoactive compound, for example. So there are lots of things that we could do to turn some of the in vivo in mammals to in vitro. And in addition, we should harmonise across ecotox and mammalian. For example, in Marina, we will be standardising and validating the zebrafish embryo test for nanomaterials, and the intention is to replace the mammalian reproductive toxicity test with that data.
That was not a question, but I'd like to answer it. And I think no. I mean, for chemicals, chemicals are in a way easier, because they are just the molecule. We have, well, for OECD methods, 40 years of experience, and we're not even close. And I think it's a hybrid to say, with nanoparticles, we get it done in a Marina project. And I think it's totally wrong, And I think the only reason for that is because there's money. And there's research money for nano, but not, you can't get a grant like Marina for 12 million or whatever to say, well, we are developing just ordinary methods for chemicals, I think that's a big danger. And probably nanoparticles are the least fit materials to bring these methods further. So it wasn't a question, but I'm very reluctant to say yes to that.
You proposed here like basically a concept, a tiered approach, and then it seems like there are different elements that we need to create and make sure that they are here, and then we have the system. How do you validate your system itself? How do you make sure that if something goes wrong in an early tier, that you don't fail, and especially because you make the recommendations to say, don't study if this and this is not fulfilled. How do you ensure that you don't have anything go through the cracks? Or how do you make the stress test? Do you have any idea how we could do this?
I mean, I think I mentioned confirmatory studies. And when ultimately, if you want to check it all, you have to run it all. But it might be even Ellen Silvergate's paper. She said, well, if you run 5 to 10% of loops, you do get a good idea. Yeah? And I also said, well, we desperately need in vivo data to have some reference points, and that's confirmatory studies and in vivo data is exactly this, I think. And that's just a number, yeah. But we have to agree on how many confirmatory loops we run to feel comfortable with it. And you probably can put a statistic number on the safety you gain from that. Yeah.
Yes, I think. Last question, please. So, any further?
Dr. Landsiedel, thank you very much for your overview of these strategies for 2020. And 2020 is, well, some say far away, but others may think it's very close. 2020, I think by 2020 we will have even an increased mix between particles and molecules in nanotechnology. And therefore my question, also thinking about what I heard earlier today about blindfolded molecules and about the in vivo formation of silver particles from silver ions. Also acknowledging that some nanomaterials are simple molecules, fullerenes, for example. And I was very well, surprised by your comment about the funding of nanotoxicology versus toxicology. Is there maybe no need for being a little bit more flexible about this distinction between toxicology and nanotoxicology? And is it maybe an opportunity for toxicology to learn from nanotoxicology strategies that you have developed or that you are developing with your colleagues?
Yeah, I mean, obviously it's an interplay, yeah. But to answer the question about funding, I think it's a fact, yeah. Out of all toxicology disciplines, maybe safety pharmacology put aside, but all other areas not nearly have the same funding. So there is a lot of money. And then I think all which was presented could well be presented under the 3R umbrella or the Tox21C umbrella or the adverse outcome umbrella. So clearly it's a crosstalk and it goes both ways. Yeah? I don't see it as a separate field. It is the more active field because there is a lot of efforts put in. Yeah? But I won't see that we save toxicology through nanotoxicology and not the other way around either.
I think that invalidates one of the questions in your testing strategy, which started with asking whether yes or no our material is indeed a nanomaterial. I don't think that is a necessarily irrelevant question if you want to investigate the toxicity of a material. It's not relevant whether it is a nanomaterial or not.
It's a good point. I like it a lot. Yeah, and I can just say, for my company, when it comes to testing, people say, well, it's not a nanomaterial, we don't need to test. And I say, well, it doesn't matter because if people die or get harmed, they won't ask whether it's a nanomaterial. So in the end, it doesn't matter. Yeah? But it's a nanotoxical, it's Q nano or nano impact net. So in a way, the question is in the room. But at the end of the day, it doesn't matter at all. You just have to. It doesn't hurt more if you get harmed by a nanoparticle or a molecule or something in between, like a fullerene. Yeah? The damage will be the same. Yeah? It's more label in this respect.
Okay, thank you much, dear audience and attendees, and thank you very much, Robert, for